Hey everybody, Dr. Ryan Dunlop here from Full Arch Masters, and we are at the completion of another Full Arch Masters flagship course. And right now I'm joined by three esteemed colleagues who have just gone through this Full Arch Masters flagship experience. And so I want to sit down and just kind of talk to you guys a little bit about your experience here. But first, why don't you just introduce yourself and tell us where you're from and what brought you to this course?
Dr. Robert Murray. I'm from Southern California. Been practicing for 35 years. And a colleague, Julia Lee, recommended this course.
Shout out to you, Dr. Lee.
Yes. And so my wife and another colleague, Dr. Loberg, we're all in the same area down in Southern California. We all decided to come. And here we are.
Here you are. Doc?
I'm Claire Cho from Orange County. I've been practicing 35 years also. Haven't done a lot of full arches, but the few that I have, I struggle with all the steps each time.
Right.
I wanted to try it the digital way to see if I could get through it easier.
Hopefully. It looks easier, right? Less steps.
It's easy.
Great. Doc?
Leif Floberg from Laguna Hills, California. So we practice, fairly close to each other, Southern Cal. Mind blowing what I saw this week. It was absolutely epic. I've done a lot of full arch cases dating all the way back to the Noble Biocare teeth in a day with adjustable abutments and guided surgeries. The digital workflow was something that I wanted to see, and this course is just absolutely awesome. It's a lot of info to soak in, but it was awesome. So appreciate I just appreciate the mentorship and everything you've set up here.
Well, we work really hard to make these courses as high impact as possible for you. Like you said, there's a lot of information to absorb. There's a lot of information to teach. Each of you brought members from your team to help you absorb some of this information and take it back to your practices. How successful do you think that was in bringing them? And would you recommend other people bring their team members?
As I said early in the course, I'm an old analog guy. I've done these types of cases where you had to lute together the jig and do the open tray impression, all that stuff. A lot of the digital stuff will probably be done by my staff. It'd be nice to streamline the whole process.
So you have to have...
If anything, the surgery is the easy part,
right,
from what I can see. But I needed something to get me into the digital world.
Great.
So,
well, you are here.
Yeah, I'm here. I'm ready.
And same question, kind of, how important is it to have other members from your team at a course like this?
Well, I can't take it all back, and for the admin to learn their part and everybody having their role, it would make my life a lot easier, knowing I can focus on just what I need and have them take off with
of course
knowledge they've gained here.
Great, that's exactly it. What about you, Leif?
I think, if I was to say would I bring them 100%, I don't think you can absorb this quantity of information. They are sponges when it comes to learning new techniques, especially the social media stuff. I just, I'm like a dinosaur when it comes to that. So
I know. What happened to us? We used to be the young ones at the courses. Now we're depending on the young kids.
You're still young.
Yeah.
No, just during this course, I turned 45, so technically, I'm no spring chicken. But yeah, you're right. We have to depend on not just younger staff members, but all team members to do their part. And I don't think there's any phase of dentistry that requires a bigger team effort than full arch dentistry. All dentistry requires team effort, but nothing more so, I don't think, than full arch dentistry. They have to be a part of the planning. They have to be a part of the surgery. They have to be a part of the technology. They have to be part of the lab. They have to be part of the case management. So you really have to have a strong team to be a successful full arch dentist. And so I think you guys all agree with that statement.
Yeah.
I wanted to ask you about technology specifically, right? I graduated from dental school in 2006, long enough to know that this technology did not always exist. And I use a lot of technology, but what role does technology, the modern technology, play in your practice, and what are you taking back with you that you're going to implement?
For me, it will be mainly the scanning, especially with the locators or whatever you call those that you put on the palate.
Right.
That will the way it all comes together with the lab and how they do that in 3D. Yeah, it's nice, and I think that alone will give me the steps to make things go faster and easier.
Right.
And so looking forward to it. Yeah. So
Great.
the good part about this course was not only did you see it, you got to do it.
Right.
And if you don't do it, you're
Right.
not going to use it. So
Right.
you have to get your hands wet.
Right. It's like cooking.
Yeah.
You can read a recipe, but unless you actually do it, you're not going to know how to make it. Thoughts on technology and what something maybe that really inspired you and what you're going to bring back.
It's just very overwhelming.
Yeah, that's true.
And I can see a lot of headaches ahead of me if I try to implement this. But
Right.
I've got the basics now that I know what I think I need to do in
Right.
order to try it and get on track with it.
It's good. It's the beginning of your digital journey, and we'll be with you every step of the way as much as you need us.
That's cool.
You've got the power of the jacket behind you.
All right.
It's like our cape. Leif, what about you?
Yeah, so I would say as far as in the digital world, we've gone through 4 scanners from E4D to OmniCam to Prime Scan and Medit. What I saw here with the Trios kind of wrapped everything together, especially done in surgery and the ease by which it was done.
Right.
So I'm excited about that component. Coming from the analog world and being able to digitize reference points with the palatal screws and tips and tricks for the lowers, that was had always gone through my mind. How are you gonna bring that back to the computer from the surgical site? And what I saw and what Dr. Murray was saying about getting a chance of hands-on, it was awesome. So from the scanning to facial scanning in 3D, just being able to, digitally say, hey, this is where I want the teeth for the lip support, or gets really hard to communicate that on the analog wax side.
Right, because you're just asking a technician to interpret your writing usually, and there's no physical perspective on that.
And then what I found most fascinating was the live section where, a couple of weeks that you had done a case and you look at the tissue and what, the digital printed teeth, and you see directly the healing response was, that was awesome.
Right. And that's typical. That's not that's not a remarkable case. That's what I see regularly when you follow the recipe that I've kind of taught you guys, is you will see vastly accelerated healing and better patient outcomes, better implant outcomes, better, more stable prosthetics. So I agree. I'm glad you noticed that, because it's one of the true powers of this workflow is to guide the healing.
Right.
And when I look back at what I used to do, and you take those you converted dentures off at a couple of weeks, and the tissue just looks like, so sick. It looks so, like ground beef, just red and bleeding. Now I take them off and it's like a pleasure. It's like, wow, that's only 2 weeks of healing. So I expect you guys to enjoy that process too, and benefit from that. And ultimately your patients benefit from it. So that's pretty cool that you guys got to see that. So, one thing I always like to ask attendees of this course is, I try to do a really good job in creating a curriculum and creating exposure modules, but it takes a big team on my end too. And I think that my team does a really good job this week. Is there anything that stood out to you from your perspective as an attendee, something that my team did that was extraordinary?
Yeah, these guys right here.
Yeah,
actually, just because I actually have never done any marketing ever,
Right.
And I still don't. And I think it's time for me to do that, because I want to pick and choose my big cases. My day-to-day
Right.
crowns and fillings is not really what I want to do anymore. So
Right.
I've got 10, 15, who knows how many more years. And I would just like to do where my skill set is.
Right. Well, that's great. Anything stand out to you, Doc?
Your team was great. Amy was great. She's the contact person
Right.
that I've had, and she's been great.
That's a shout out to you, Amy.
And then for you, Dr. Dunlap, I have to say you did things very practically. I mean, it wasn't like you have to do it this way. This is my feel, or it just made it very much more realistic, because in the everyday world, we don't follow it just as they tell you. And so that really made it more acceptable.
Right. My wife tells me all the time I'm the most adaptable person she's ever met. Like, just plop me on an island somewhere and I'll just figure out how to get off of it. But yeah, so dentistry has to be adaptable. You have to be practical and realistic. Anything stand out to you, Doc?
Yeah, definitely the FAM media team was incredible. Just to be on the backside and witness how things happen.
How they come together. Yeah.
Whether it be in live surgery or just lecture or something fun.
Right.
So that was a huge takeaway. Raina, great, fantastic trainer on the chair side assisting side.
That's a shout out to you, Raina.
With from the photogrammetry.
Mm-hmm.
Yes, I mean your team over the top. I mean you can tell the amount of training that you've put into them,
Right.
And it reflects. It's
That's not
fantastic.
easy to do. It takes, I don't know if I'm supposed to interrupt.
I think it's echoing the same idea. Yeah,
Yep.
no, it takes time, it takes effort, but it also having the right people, and you guys know that as well as anyone. They have to have that spark, and they want to learn, and they have to have a passion for teaching and helping. And I've cycled through a lot of people who just didn't have that. They enjoy the work, but they don't want to teach it or don't feel comfortable. And so you have to be in the right mindset to be successful doing that. Yeah. So, and you gave them all goosebumps over there. The reality is we live in a media-driven world. And if you want to do more cases like this and you want to be able to select them, if you want to grow your practices and, do more cases like this, you have to have some way to speak to those people, because they're nervous, they're scared, and they're getting bombarded by media constantly. And some of it is great and some of it is very disruptive and not helpful. And so to be a voice, you guys all have experience, you've been in the field for a while, to have a voice that conveys that trust and that safety will get you those cases and will allow you to help those people who are appreciative. So being part of that media environment, I think, is a necessity. And it's good for our profession. The more talented, competent doctors out there who are talking can drown out some of the more, disruptive and less productive talk that's out there about things that kind of distracts people from the truth, which is you need a good, well-trained, experienced doctor to do this for you. It's not like buying a car. You are having complex surgery and it requires an expert eye. So I encourage all of you to get into the social media and the marketing marketplace because we need more good voices. There's certainly enough bad ones. The last question I always ask is, imagine you're talking to a colleague who's kind of on the fence, doesn't know if they should take this course or if it's right for them, and they're just kind of going back and forth. I'll start with you, Leif. What would you say to someone like that?
I mean, without a doubt, I give this course 2 thumbs way up. There's not an ounce of fluff anywhere in the curriculum or the program.
Right. We struggle to fit it into 4 days.
And I see that, and without hesitation, I would highly recommend you guys. And I actually discovered you through one of my associates, Dr. Quinn, and
shout out to you, Dr. Quinn.
He was on Instagram, and he said, "Hey, you got to go check these guys up in Fresno. I think they're the real deal." And that was Full Arch Masters. And
nice.
I wouldn't hesitate to recommend this course to anyone. I mean, I think you do need to have some surgical experience.
For sure. Or some, just kind of workflow experience.
Right. Some, I guess, how would I say, some knowledge of, being able to work with a computer would help. But hey, you're taking basically three analogs here.
Analog, what'd you say? Analog dentist living in a digital world.
Yeah,
that's the takeaway quote for the whole week.
Yeah.
Any thoughts on what you would say to somebody who's kind of thinking about this?
Well, it's something we all have to do going into digital dentistry.
Right.
And so anyone who is wanting to or need to get the information.
Right.
I think Dr. Loberg said it the best. There was no fluff. It was packed 4 days, and we learned a lot.
Great. And a special recognition to you because full arch dentistry is often dominated by men. This is something that I have seen for years, and I always try to encourage female dentists to come to my courses to get involved in full arch dentistry because they need to be, 100% they need to be. So you get special recognition because you are a female doctor who came to the course, and most of my courses have only 1 or 2 women who come through the course. So it's definitely a big striking difference between the sexes there. A lot of men go to these courses and learn full arch dentistry. And for some reason, I haven't put my finger on exactly why. There's probably a lot of reasons why women hesitate a little bit to get involved in this type of dentistry. And so it's always been a goal of mine to try and get more female dentists to embrace this because they can be just as good, if not better, than any male dentist at doing these cases. And so we need that in the profession for balance, So
women
special,
dentists, we gotta get in there.
Yeah, most dental schools have a higher percentage of female graduates now.
Yeah.
So it just makes perfect sense that full arch dentistry should be 50-50 or even over time, more female dentists just based on the population, but that's not what we see. We see a predominantly male-dominated marketplace. So I just want to give you a special shout out for that. Not to discredit you gentlemen, but it is important that we get female dentists involved in this. So I'm always happy to say that. So anyways, I appreciate all of you taking time out of your lives and your businesses, basically closing down for a week. I know how that would impact me. So I appreciate all of you coming to this course very deeply. And I wish you guys all the best. And we are here for you. This is just the beginning. And you guys hopefully have a lot more interactions with us, and we are able to help you along this journey because it never stops.
WhatsApp was cool.
Yeah.
I read now; it's dinging all the time on my phone, and I'm enjoying reading it. So.
I cannot tell you how valuable our community is, and there are so many doctors that have come through this course that are at different stages and encountering different roadblocks and posting cases and questions and new products. And so the community that we have created at Full Arch Masters is by far our biggest strength. And you will learn things from other dentists in these groups that you've never met. And then one day there'll be an event that you want to go to, whether it be it a symposium or a class that we have or some sort of event. And you'll show up and you'll meet somebody that you've talked to online about this for a year, and you're just instant friends, and so there are just hundreds and hundreds of people around the country and around the globe that are just as excited as you, and they become addicted to these groups because there's so much valuable information that gets shared. And it's fun for me when I wake up. I'm on the West Coast. We're all on the West Coast, but when you wake up in the morning, I open my phone and there's like 75 messages. So it's fun. It's camaraderie. Not a lot of dentists have that group that they can ascribe to, and so I think that's a great part of what we do. So that's part I'm
cool.
really proud of. So anyways, thank you again, and I appreciate you guys taking the time, bringing your teams, and enduring all of this travel and expense, and just so I hope you get a lot out of it.
We did. Thank you.
Sure,
Very
very well.
good. Very good.
So thank you very much for tuning in to another edition of the Full Arch Masters podcast. I'm Dr. Ryan Dunlop, live from Fresno, California, at the completion of another successful flagship course. You can check us out on our website, fullarchmasters.com, and make sure to follow us on all the socials. And we will talk to you soon. Stay tuned for the next edition of the Full Arch Masters podcast. Have a great day.